You know, we've spoken a great deal about the issue of chronic pain patients, and the agony that they're experiencing. And you've heard chronic pain patients talk about having attempted suicide. And we know that suicides have taken place. And we challenge doctors, or at least the medical colleges, colleges to come on the air and defend their positions. Well, now, this is very interesting, if you're not aware yet. In an email to the Executive Director of the Chronic Pain Association of Canada, the Registrar of the College of Physicians and Surgeons of Ontario has declared that Ontario doctors must no longer taper patients inappropriately or arbitrarily from their opioid prescription medications. Now, the question is, are the details in the devil, or is the devil in the detail? Whatever, however that thing goes. Terry Bremner is the president of the Chronic Pain Association of Canada. He joins us on the Roy Green Show on the Chorus Radio Network. So, Terry, thank you very much for the time. So the registrar of the CPSO sends that email to Barry Elmer, Executive Director of the CPAC. What exactly are they promising, or is the devil in the details?
Roy, thanks for having me on, first off. Dr. Whitemore's decision to get in contact with us blew us away in the sense when we look at all the struggles and patients that have lost their medications and lost their doctors. And yeah, some of them have taken the road to suicide, which isn't a very nice thing to talk about. So in the decision that Dr. Whitemore is coming out with and saying that they're not going to follow all the guidelines that were set out in 2017 and they're no longer be required to force tapering on these chronic pain patients. What a shock when you think over the last 10 months or the last 2 years, the fight that we've been having to get someone to believe us. CPAC had to go out and do their own survey to get their information out there. But yeah, you know what? We were really surprised to hear back from this level of the health department in Ontario.
So what I'm looking at here is a couple of lines from the news release from the Chronic Pain Association of Canada. Rather than requiring physicians to follow the 2017 Canadian guideline for opioids for chronic non-cancer pain, the final policy states that physicians must be aware of relevant guidelines and apply them as appropriate. The policy permits physicians meaningful discretion to apply relevant guidelines as they see appropriate and with consideration for the needs of each individual patient. Goes on to say the final policy now includes a dedicated section on tapering and discontinuing prescriptions with emphasis on the fact that physicians must not taper patients inappropriately or arbitrarily. I'm looking at this line that says physicians must be aware of the relevant guidelines and apply them as appropriate. What does that mean?
Well, after what we've gone through, and fortunate you've had a number of shows talking to people.
Quite a few.
Suffer from chronic pain. And Roy, this is a disease. This isn't a health condition or something that's going away. This is a disease. So what we've seen over the last while where they were forced to follow the guidelines, and some doctors even went past that and dropped their patients and would never prescribe anything to chronic pain patients. So to see that they list into the discretion of the guidelines, the best part is at the end of that part about the consideration for individuals, mm-hmm. because what may work for me, Roy, may not work for Mary Brown, yeah, or Bob Smith, but it works for me. So we have to be individual on this, and chronic pain is such a complex disease that it doesn't take just the medications to deal with our problems. Yeah.
So the whole idea, though, here, Terry, has to be that the doctors understand that the CPSO, the College of Physicians and Surgeons of Ontario, and I hope others follow suit, are telling doctors to not proceed with arbitrary tapering without consultation with the patient and hopefully without the agreement of the patient, and not just say, well, we still have the right to do what we want because we're working within the guidelines. It's a good first step, but I'm still watching very carefully how this develops. Terry, thank you so much for the time. Much more work to be done, but the CPAC has done a great job.
Okay, thank you very much, Roy.
All the best. Terry Bremner, President of the Chronic Pain Association of Canada.